Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Chief Public Health Official and Director for the City of Nashua's Division of Public Health and Community Services. And I have with me today Dr. Karen Maynard, who is an OB-GYN specialist at Southern New Hampshire Medical Center or Southern New Hampshire Health Center. I mean, it goes back and forth, right? And so now we're Southern New Hampshire Health Systems, and a lot of folks still know the hospital as Southern New Hampshire Medical System. So welcome today, and we are going to talk about all things related to women's health, which I think is very, very important. And in particular, we're going to talk about menopause. But Dr. Maynard, you have been in OB-GYN or obstetrics and gynecological practice for how long now?
Well, thank you, Bobbie, for having me. I've been in practice here in the city of Nashua for 26 years. And it's been a pleasure being here in Southern New Hampshire. It's really been a fantastic journey. I feel privileged to be able to care for the women of Southern New Hampshire, and I work specifically through Women's Care of Nashua. And I take care of women really female patients, from as early as adolescence to end of life kind of situation.
End of life?
Yeah, I mean, I will definitely take care of patients in their 80s, and I've had a couple 90-year-old women that we take care of. So, yeah, I still do it all.
Yeah. So let's talk about that, because I think women's health sometimes gets overlooked. We were talking earlier today, and you talked about the differential in, for instance, in specialty practice, which OB-GYN is a specialty area of practice, and the difference between what an OB-GYN might get opposed to a person who might be doing bariatric or doing the GI stuff. And I look at that as, well, I think that's a little bit of bias, because women, we're 49% of the U.S. population. And in New Hampshire, I think we're about the same, about 49, to like 50% of the population here. And yet the priorities of our population don't seem to be as high as for some other things. So can you talk a little bit about that? And then can you talk about why it's so important for women to continue to seek care from a doctor such as yourself or a clinician around women's health all the way into their 90s?
Right. Well, I think that women drive the health care of their families. And so that's what's really important, right? Because if they're the usual caretakers for the children, and so they'll bring them into the hospital and keep track of them. But you need a healthy mom and a healthy woman within the family to continue with the whole care of the family. But I think that it is important to, you foster people through their pregnancies, but then afterwards, when we get to the point of our mid-40s to late 50s, that's that menopausal time. Mm-hmm. And a lot of things do go on in our life and in our bodies hormonally that isn't always addressed. And a lot of women silently suffer with it. So I think menopause is an incredibly important topic that I do address with all of my patients. But most people see their primary care doctors, which are usually internal medicine or family medicine providers, and they have all these other very specific issues and just don't realize how important your health is in terms of your menstrual cycle or not having a menstrual cycle. Mm-hmm. And what can you do about it? And so as OB-GYNs, we are like the primary care providers for women, but to do specifically regarding whether it be having babies, pregnancy, fertility, menopausal issues, menstrual issues, incontinence issues, all of it, right?
Yeah.
We take care of it all, and we foster these relationships. I've been seeing patients where I've delivered all 4 of their kids and, taking care of them through, and now I'm delivering their kids' kids.
Yeah, yeah.
So with that generational continuity, I feel very blessed to be able to do that.
Oh, that is so awesome. And so now you're seeing some of the babies that you've delivering babies now, but you're able to also continue to just provide that care, throughout if you want to say the lifespan. Mm-hmm. So let's talk about menopause, because that's something that just recently There has become some greater awareness about it. There's been federal law that's been passed to increase research and increase education on menopause, and the NIH is actually in charge of directing some of that emphasis around the research. And so why is that so important? Because one of the things that, with a lot of things that you were talking about as far as periods, we used to didn't talk about those things. Oh, it's just your time of the month. You know, there was all these code words that were used where this is a regular part of a woman's health. And there's nothing embarrassing about any part of our life's trajectory or health, or even the changes that happen even in our bodies, right? When we talk about menopause or we talk about some of those changes that even like appear on the outward, you know, there are things that are going on with menopause that are internal that, you know, just the person, you know, who has the uterus is going through, but yet our partners and our friends and other family members need to be aware of some of the outward and inward effects and impacts on our bodies when we're going through some of those things. So can you talk a little bit about the symptoms and, you know, how people need to manage and why women should not be afraid or embarrassed about the changes that happen in our bodies?
It's true. I think that it's getting a little more airtime out there, whether it be in social media, as more public-facing women are talking about it, and with even in our own OB-GYN world, there is a growing society called the North American Menopause Society. And so it's bringing all the experts together to look at the data and evaluate what's going on and what can we do to help women through this very transitional time that's so formative. Because when women are in their 40s to 50s, they're the pillar usually of their household and community, and they're at their top of their professional careers usually around that time as well. So it's important that they're healthy, that they're feeling well, and that they're able to function. Menopause is usually defined as not having a menses for more than 12 months. But for some women that can be a little tricky. Some women may have had their uteruses removed or might have had a surgical procedure where they don't menstruate anymore or have a hormonal intrauterine device that prevents them from having menses. So it's not always the easiest thing to determine. So again, that's something that when you are there or have other symptoms, you know, talking to your provider is important to see where you're at. Menopausal symptoms, the most common is hot flashes. And hot flashes can be during the day, they can be at night. We call them night sweats, but they're the same. They can be very, very debilitating in the sense of you can get completely fully drenched where you have to get up, change your clothes, sometimes even change the sheets on the bed. And if it's happening publicly, when you're publicly speaking, it's just, it's tough. It's embarrassing for women to go through that. There's issues with anxiety, with issues with weight gain, especially as you pointed to your belly. You know, I call that
Across
the energy pack, right?
Yes,
I
the reserve.
The reserve.
I like the reserve.
Yeah. So, and that is a natural thing that happens to the majority of women. Very few escape that bodily change. And it's, you know, it's disappointing to us because here in America we have this ideal body, you know, that everybody wants to strive for. But who says that that is anthropologically what we're supposed to be, right? You know.
And it's void of the reserve.
That's right, exactly. So other symptoms, you know, can be the insomnia. And that's a tricky part. I talk to many women, they're like, yeah, every day I wake up at 3 in the morning. I don't know what it is, but I'm up. And then, you know, many can fall back to sleep, but it's part of those symptoms. The low sex drive, you know, that's a big change. And again, something that we're growing up with, what we see on TV or videos or all the movies of everybody always having sex. Well, so people think something's wrong with them when their desire's less than what it used to be.
Right.
But that is a normal biological change, and how do you deal with that? And so being able to talk to women about it, talk about the options. There are a lot of different options out there. Luckily, we've gotten more and more data to try to help educate women and also give them some relief with all of that.
All right, and so we're having this conversation because we really want to normalize and help our viewers understand premenopause, menopause, and perimenopausal are all normal parts of, the lifespan for women, people with uteruses. And so, to be inclusive in our language, we'll say that. But it's typically, you have to have, the uterus or the ovaries to have some of these, experiences with menopause. But they're normal, right? And so, we were talking about the fact that, with the sweats, and they can come at any point in time, right? Earlier, you talked about anxiety bringing on some of the
hot
increase,
flash.
the hot flash, and the increased moisture or dispensing of moisture in certain areas of our body. When I was going through menopause, I called it the glistening, because all of a sudden you would just start glistening because the sweat would just come up, and your face is all shiny, and some people it's worse. It's not just that they feel that they have wet armpits or what, because it's all over. It'll be all on your chest, and the whole body just gets overheated, and then you're just wet. Right, and so it's this thing of embracing this is another part of our lifespan, but then also helping people not feel embarrassed about that, because if we live long enough, we're going to go through that, and it's going to happen, right? And you talked about there's some different types of treatments for that, and so what are some options that people have for addressing some of those moments? I'm going to call them moments. I'm not even going to say that they're embarrassing, but just some of those moments, because they will happen.
Right. Well, sometimes some of the things that you can do are just avoiding triggers, right? So the simple stuff of what can often set off the hot flashes or not sleep well would be alcohol intake. Caffeine, excessive caffeine can also set that off.
Right.
And then if you're in a stressful situation, right? So ways to sort of calm yourself down. Exercising on a regular basis and burning off that energy so that you're having a more restful sleep can help with some of the insomnia that you might suffer from. There are some natural supplements out there that people try. Wild yams, black cohosh, some of the estrogen, plant-derived estrogens that are not at a prescription strength can be helpful with some of those symptoms. Soy products, a lot of women will try to eat some more soy in their diet and can help with some of those symptoms as well. But then many people do have to rely on prescription strength. We say the best, but the most effective that we have our studies on is the use of estrogen. And if you have a uterus, you need to have progesterone with that. But if you don't have a uterus, you may only just need the estrogen. And they come in so many different formulations, whether it be a pill, a patch, a cream, a ring. There's sometimes some people are putting it as a pellet underneath the skin. So there's a lot of different ways of getting those products. But, again, talking with your provider, having a conversation of what you are looking for relief, what is best for your body as well, because your medical history plays a part in what you're able to take or not. You need to be careful about adverse reactions with other meds or with, if you have any kind of history where you're not allowed to take estrogen, such as women who've had estrogen-dependent breast cancer, or women who might have had a blood clotting disorder. Those are sort of the absolute, you cannot have estrogen. And so you have to find other options. There is a great website that was developed by the North American Menopause Society, and it was funded by the National Institute of Health. So, and it's called mymenoplan.org. And mymenoplan is one word. And it is a great website that was developed for women to review. To click off, like, what are your symptoms? What is menopause? Define things. And then let's look at the data. What what options are there for you for treatment. And they have data behind all of those options. So you can go very superficially into the website, or you can go really do a deep dive as well and find their references and look at the actual studies if you want to. But this website is written at an 8th grade level so that any person can really utilize it. And it's a great platform for when, if you review it and then you go to your provider, you can have a really well-educated conversation about what might work best for you, and have a better understanding from the base.
So Dr. Maynard, do you believe that now that there's more airtime on the issue of menopause, that also in some of the training for healthcare providers, so as an OB-GYN, that's a specialty area, so the nurse practitioner who's a generalist, or some of the other clinicians that we might see, are they also getting this education and this information and this awareness so that these conversations can be more normalized with clients or patients when they come in? Like, for instance, when do you start talking with women about menopause?
I think that there isn't as much education as I would like to see. It's keeping me in business, thank you, but, so I get all of those referrals, which is fantastic, but we could be better about that. And I think making sure that it's a strong part of the curriculum, women's health of any of the family medicine nurse practitioner groups, or even the physician assistants, getting in there and getting that exposure. I think they get a few lectures, they might get a day of an exposure, but is that really enough?
Right.
But again, there's so much medical stuff out there. I do think it's hard being a primary care provider because you kind of have to know a little bit about everything.
Yeah.
So, but starting the conversation, it really should start when people come in and they should be asking, well, how are you feeling, and how are your periods, and what's going on for you? How are you sleeping? Or look at, have they had a weight change? Our data says that when a woman is starting through the change of menopause, if they eat the same and exercise exactly the same, but their body's starting to change, they will gain 10 pounds if they do nothing more. And then but what happens is when you go through menopause, you're not sleeping as well, you're more stressed, you're, upset with what's going on. So really it's more like a 10 to 20 pound weight gain before you're through that process. And that's hard. That's a significant amount of weight for a lot of women, but you all see it. So, and the primaries could see that instead of saying, oh, what you're doing, that should prompt them in the conversation, because so many women will say, I'm eating like I always have, I'm exercise like I always have, what's going on?
Right, yeah, and for just personally, when I noticed the change in the middle, all of a sudden it seemed like it was just there. It's like, where did that come from? And now how am I going to get rid of it?
Right.
And now I've come to embrace, I used to call it my bread basket, but now I have a better understanding of, the reserve, and why is it important to understand why I have that reserve, right? So earlier you talked about seeing women well into their 90s. Can you also talk about the importance of why women should continue to go in and be seen by their clinicians as we get older? So maybe they're not having sex, maybe they're not in, they're out of their childbearing years, but why is it important for women to continue to see a clinician with regard to their women's health overall?
Right. Well, because our bodies do continue to change. And we know as women age, 1 out of 8 women can develop breast cancer just because you're a woman and you were born, most women, with breasts. Ovarian cancer increases as you age. And so how else will you determine that or see that unless you're examining them and doing an exam? Now, does it have to be after age 65 every year? Not necessarily. If you're not on any prescription medication like hormone replacement, then it probably could be every 2 to 3 years. But somebody should be examining you, doing a thorough clinical breast exam, doing a thorough clinical pelvic exam and making sure that there's no ovarian masses, the uterus feels the normal size. So many people feel like women's reproductive organs and just being, what makes them a woman doesn't matter anymore. They're all like, oh, well, you can get a mammogram, but mammograms don't pick up everything.
Right.
I mean, the clinical exam is really important as well. And I think even, as we age, it's harder for us to inspect all of our parts, right? Just like we try to go to the dermatologist, right, to check, make sure there's no unusual growth. Well, that happens for women on their vulva, right? Things can grow and they're like, I don't know, I didn't know it was down there, So having somebody clinically looking at you is important. And, so for me, it's very important, but so many don't have an exam, especially after childbearing. That's what I see often. They're like, well, I was done having kids. What did I need to go to the doctors for?
Yeah, and these parts are still a part, of our overall health and our well-being. One of the things that some women, as they're going through some of these changes, they end up, because it's also hormonal, some people experience depression, right? And so this month is Suicide Prevention Month, it's Recovery Month, and if people start to go through depression, they may want to self-medicate, and so they may increase their alcohol intake, or they may start doing other things that then leads to other areas of health that need to be addressed with their psychosocial and emotional health, and then behavioral health as well. And so can we talk a little bit about like some of the mental health and the stress and anxiety that also goes along with some of these body changes perimenopausal or menopausal?
Yeah, I think when most women go through the change, they're between 45 and 55. The average age of somebody truly through menopause is 51 to 52. Well, think about that age. Also, you've got kids going off to college most of the time, and then you have aging parents. And then you're working. So that is a very stressful time for women, that they're kind of in charge of both generations, right? And, the generation above them and the generation below them. And then their body's changing, and they're not sleeping well. And it does all play into it. So many women are told, well, just, you have to toughen it up or whatnot. And it's true that, these women need some help. And there are medications out there that you can take, or just whether it be getting into more healthier habits, eating a little more clean with less processed foods and less, sugar additives, so that it can help you feel better as well. Exercising on a regular basis, getting into groups. That's oftentimes, I find, is the healthiest thing, is when women have a group of other women, that they bond together and they have similar interests and do activities outside of the home or outside of work to, have good camaraderie. And that's when I feel like those patients of mine seem to thrive better and manage much better. Yeah. But it is important to address it and have those conversations with patients all the time.
Yeah, and for people not to be afraid to have those conversations about those changes in their bodies. And so some of those social situations or social gatherings, when people are coming together that are going through some of these common experiences, it's okay to talk about menopause. So we're not saying that we want people to run around with signs at work, I'm going through menopause. We're not talking about that, but actually recognizing that that could be something that you're going through, and that it's okay to talk about it, especially with a healthcare provider.
Yes, I agree.
Yeah. I appreciate you taking the time so much to talk about this very important issue. And in your specialty area of practice, you're dealing with moms through their childbearing years to post, what do you call that when you get past the childbearing years?
Well, that's sort of the perimenopausal years, and then menopausal, and then sort of you're menopausal for the rest of your life, right?
Yeah,
so that's continuum, but just, that's what I call it.
That's what you call
menopausal
it.
years, I guess.
I mean, it's just, it's living, right? And so these
absolutely.
are things that are just going to happen just because we're living. So what are some of the most important takeaways that you want our viewers that are watching today on Public Health Matters to understand about the whole conversation about just women's health in general, and then getting through menopause, and then postmenopausal, the important aspects of our health, even including with vaccinations and all that other kind of stuff like that. We didn't even talk about HPV, did we?
No, so I don't know if we have enough time for that topic. We may have to come back and have a little conversation about that. But I think what's most important is to start the conversation. If you only have a primary care provider, don't be shy to just bring things up and ask them, if you're concerned about what's happening with your body, why is it changing? Could it be menopausal changes or perimenopausal changes? And then if they're not feeling well versed in it, have them refer you to an OB-GYN. All of us are, the generalists anyways, are very versed in it, enough to start the process, have a conversation, help you through that journey. For some people, the journey is short and they only struggle for a few months. But the majority of women do struggle for anywhere from 2 to 3 years with all of these changes going on before they kind of even out and feel back to themselves again. And there's a lot that can be done. Like I said, it can be as simple as just lifestyle changes, dietary changes, sleep habit changes, to as complicated as a couple different types of medications that you need to take to be able to alleviate some of these symptoms. But it is a conversation, and it's not a short one.
Right.
And so it's not like, oh, by the way, and I only have 2 minutes to talk about it.
Right.
So make sure you find a provider who will sit and have that conversation with you.
Right. And every person presents differently.
Yes.
With these different symptoms, right, as they go through this process of change. Some, as we talked about earlier, have some symptoms that are more intense than others, and some kind of just like, oh, did I really go through that?
It's true. It is different for everybody, and some are severely affected and others minimal. And you have to have that conversation with the patient of what's most important to them.
Yes.
And it's just, again, meeting on common ground and listening to what they're saying, and then recognizing that and helping them through.
Yes. Dr. Maynard, thank you so much for taking the time to be with us on Public Health Matters. Menopause is a very important health issue for women. We want it to be more normalized. We want people to feel comfortable having these conversations. Most importantly, we don't just want women to be comfortable, but we also want partners, co-workers, and everyone else to understand, right, that this is a normal part of who we are as women and the things that we experience. And one of the key things that I really like that you talked about is the fact that if you have any questions or concerns, or if something seems like it may be above and beyond what the normal is, make sure that you contact your clinician to get some answers. And don't forget to visit mymenoplan.org.
Yep, that's exactly it.
All right, awesome.
Thank you.
Thank you so much.
Thank you so much for having me. I appreciate it.
I'm Bobbie Bagley, reminding you to have a great day today and a better day tomorrow. I'm looking forward to seeing you next time on Public Health Matters.